Hi, this is Dr. Kirk Lozada. I'm a facial plastic surgeon and rhinoplasty specialist at Penn Medicine Becker ENT, and this is 2-Minute Consults. The lower eyelid has some very important anatomy that becomes critical when discussing surgery. First off, the skin is the first layer of the lower eyelid, and next, behind that, there's a very thin muscle called the orbicularis oculi muscle, and underneath that, there's fat. Each of these 3 layers can have a problem, and each of those 3 layers that have a problem needs to be addressed specifically. If you don't, you're going to get a not good aesthetic result or potentially have a complication. What can go wrong with the skin as we age? It tends to get loose and look like crepey skin that patients see, and they tend to want to pull and flatten out the skin creases underneath their eyelid to make it smoother. This shows us that there is loose skin and that needs to be excised. Second, the muscle over time can get loose. This can cause a little bit of laxity or looseness of the lower eyelid, and so if the muscle is loose, it's very important to do surgery and tighten that muscle. If we don't, we really can cause some functional issues for the patients that we weren't anticipating. And number 3, most commonly, the fat can be what's called pseudoherniated. So the fat itself can cause puffiness underneath the eyes. And that's one of the main complaints that people come into the office for. They notice that their eyes over time are getting puffier around this area and they want to do something about it. So the reason is, why are they having all that puffiness? So part of it is the fact that the fat is tending to push out as they age from around the eyeball. And that fat is one important component, but the second component is also, typically in most patients around their cheek, are losing volume. So that cheek volume is not sitting up nice and high when they were young, it's falling down. And what that's creating is that typical classic appearance of the lower eyelid that people feel is very tired, very dark, and something that they really want to fix.